You're gonna really be happy with our form
There's
of
a
treatment.
bad
This
one
guy
there.
here.
What do you know? What do you notice under her eyes?
Bad dark.
No,
No.
not so much.
Yeah,
The little
she's got-
bumps.
Yeah.
Oh,
got
yeah, I
milia?
have, I
Mhm,
have
has
the little,
milia.
Mm-hmm.
and
Now,
they drive me
a
crazy.
lot of times in the brow, she has some
She has a
sebaceous,
little bit sebaceous up here.
hyperplasia. Mm-hmm.
This machine will do that too?
Yeah,
Hey,
in a
girl.
real delicate way.
Ooh-wee. Yeah, those have bugged me for a long time. There's one on my nose here. I wish I don't know what that little bump is right there.
Okay, does that look like anything that we treat necessarily? Just from the get-go, it doesn't to me.
No.
So let's
I can
look
see
at
the
take
blood
a
More
vessels
like a
in it.
little wart
yeah.
thing.
You don't mind? You can close
Okay,
your eyes
you
for a
look.
minute.
Then I get to look.
So cool.
Can't
You'll see the blood, the vascularity. So that to me would be like a clear mold. How long have you had that there?
Yeah.
Sorry.
The last year. is when
Oh,
I really
okay, so it's
started
relatively
noticing. It's
new.
fairly new.
Okay.
So that one I
guess
can't
that
do
comes
anything.
with age. You
No.
start getting warts
No, I
like old
can't help you
witches.
with that, dear.
And I wouldn't call it a cherry angioma.
You can see all the little spider
You,
veining
you
in there.
can underneath it. Now, if we let just scratch, you just don't need to. Okay, I'm gonna take that.
My
use
big deal was to
hands.
go to Blake's, so I'm done.
Stick the barrel in a little bit further. And now watch, when I close down, a tiny bit of the barrel will be showing.
Will show.
That's a little bit, doesn't have to be perfect. But good, you have, your probe is very steady and all now.
Okay.
So I'm just gonna throw that over there. You usually see the sebaceous hyperplasia in this area, like the glabellar area. Okay, now, let's pick out one. See that one right there? Okay? All right, so what I'm gonna do is I'm perpendicular. I'm just gonna take tiny little counterclockwise. Sebum's already coming out. Good. It may sometimes appear that you're puncturing the skin, but you're not.
No,
The
you
sebum's
just-
being drawn up.
So it kind of scoops
Yeah,
up.
and I'm gonna go, let's see. I want that to fall. There it is, right there. So now I'm gonna do one in the middle. Perpendicular. Just turn that way a little bit. Good, Pam. There we go, and watch.
Oh, yeah.
Okay? Now, I start out with my 3 or 4 in the alcohol or the witch hazel. So what I'll do is I'm just going to dab that a little bit, and I'm just going to roll it. I don't want to disrupt the skin too much. Okay, it's not really going to come out completely, so I'm going to leave that alone. But that'll dissipate. It'll dry up and it'll slough off. Okay, now let's do. I'm going to demonstrate an age spot. So we have the universal
Right?
F12 in. Now, these need moisture. I'm going to have you turn this way. Now, see, that one was already treated, but I would feel real confident treating what
Treating
was
it.
remaining.
Yeah, I was ready to go for it.
Okay?
And she'll love it.
So, got power. Oh, what is our, what's our setting?
Let's see. We're
It's
on,
between 30 and 40.
hyperpigmentation,
Yeah.
20 to 30.
Oh, it's 20 to 30.
Flat hyper.
Yeah, flat hyperpigmentation, sorry. Okay? So you'll learn to do this. I just keep it in this hand this way or whatever. I dab. You don't want to saturate it too much. Just need some. Okay. I'm gonna get a good stretch. Got my power on. Let's pull this up a little bit. And I'm just gonna tap, tap. You feel that? Okay. Tap, tap, tap. This one's actually raised a little bit. So, good. Tap, tap, tap. Give her a break. See, I'm keeping my station real good here. Okay. And then I'm moving to the left. Tap, 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 tap. Until I do the entire area that's discolored. Now, for demonstration purposes, I'm not going to do it, but we could actually wipe that away. But we don't want to do that because that disrupts the healing cycle.
Right.
So we're going to let her go. Now, it looks like to me that I've missed a little bit. See, there's a little bit more on that left side. I'm just going to do, okay, I'm perpendicular. I got my foot on. I'm tap. Pam, you're great. Tap. Tap. See, it's changing color. It's going to an opaque color.
Yeah.
See, you still have that half. So this is a combination. This is a little bit of an elevated. Tap, 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 tap. You don't want to try not. Tap 1, 2. All right, you're a little quick. Tap
Okay.
1, 2. Okay, that's traditionally what I find with folks.
Okay.
Just wait till it changes color. You don't want to be on there too long. It's just tap 1, 2.
Around over there.
and go to the
we can
next
really
one.
see. She doesn't mind.
Tap
yeah.
1, 2.
Oh, I gotta put the foot pedal down.
Yeah, you're
Go
on.
pedal.
Good.
Tap 1, 2.
Good.
Tap 1,
A little fast. Tap. Keep it on. Tap 1, 2.
2. Okay.
Tap 1, 2. Good. Good. Okay, give her a break. Yeah, you see him disappear?
Yeah, give me a break.
Oh, okay. Sorry, girl.
Let me just look in from this side.
Absolutely.
There you go.
Good.
One in the middle, right?
Yeah, and you see how that reacted? You know you've treated that, so you're gonna.
So now I can go good that one.
Look, they're. I don't want to say they're everywhere, Pam, but look,
They
she
are.
actually has a couple blood vessels.
Mm-hmm.
Nah,
Yeah, that's
nah,
what I was looking at.
Nah, it just might be some. It's more like the creasing of her skin, isn't
Yeah.
it? Yeah, yeah. Because the blood vessels aren't classic there. Okay, so try to
Well,
find
let's do
another
this one
sebaceous
right here.
hyperplasia. Good. Your technique's excellent. You're vertical. Good. Good. All right, give her a break and then finally do the center. It looks tedious. It is somewhat, but once you go quick with these, really.
Absolutely.
Okay, now,
To me, you've got one right there.
where's the one I treated?
Yours is. Where'd yours go?
Okay, if you're not sure, I might have treated that
You might
one.
have treated
Yeah.
that one. Okay.
Okay.
Because he wiped it.
Yeah, because it's white. Yeah, you did.
Mm-hmm.
We've got a little one right here.
Okay. On that one, you might not have to do quite as many circles. Might just be able to go into the, yeah. Perfect. Nice. All
I
gone.
don't feel that one.
No, that was a good one. Just got perfect. Let it sit for a second.
And we're
Sandy,
using
you're
this one.
You're all right for a 60-year-old plus lady.
I love my job.
You're great.
Okay, now, I was taught to do little circles all the way around, but we're not going to do that. We're going to
No.
tap 1, 2, 3.
Tap
No,
no.
no.
No?
The tap 1, 2, 3. This is, remember, this is the unique one. It's just tap, tap,
Oh, that's
tap.
right. Just keep moving and tapping.
Yeah, because this
Okay,
is right on
gotcha.
the skin.
And perhaps just a little quicker tap. Tap,
Yeah.
tap, tap.
Tap, tap, tap.
You want to see it change color.
And it
Okay.
will.
So, yeah. So start out in the right quadrant or wherever you want to. Good. It's kind of tedious. Good. You hear the sizzle. That's good.
Let me know. Give you a
Okay,
little
that's
break.
perfect. Just 4 or 5 and then come off. You doing okay, Pam? This one's ouchy, isn't it? Yeah, so maybe 3 or 4 come off.
It's right there with the bone too, not more painful.
Mm-hmm.
Yeah, skin's a little thinner there. Good. See, that's great. You're working cross and you're working top to bottom or whatever. Yeah.
Yeah, you're
Good.
very methodical. That's great.
I've been called anal retentive too.
That was on the tip of my tongue when I first. No, I'm just kidding.
We'll call it methodical.
Okay, I like that.
But look, yeah, get your
Mhm.
stretch
Oh, it's
and let's
already
go.
looking
Let's
good.
get
Let's
out
get
to that.
this here.
Mm-hmm. The color usually gives away the areas that you've treated already. So good. Mm-hmm. Good. And you're not going to disturb her skin if you happen to go a little bit out the boundary. It's
Okay,
fine.
that's already looking good.
Yeah. So let that. Yeah, good stretch. See how that it just pops right at you when you stretch. Okay. A few more taps maybe.
Okay.
You're dry now. Give it a little dab again. Good. Now on this one, you could almost lose your perspective.
Yeah, you can
So
get lost in this
I
one.
would just leave that now. Good job.
And just
Excellent.
let that do
Mhm.
its thing.
You talk about hurt.
No,
that
it shouldn't hurt.
No, that permanent eyeliner.
No,
Oh,
it
my
shouldn't
gosh.
hurt.
No, you're wrong.
It
Good.
should never feel like you have needles around the eye. The eyebrows hurt and the lips, but the eyeliner shouldn't hurt.
Oh man, it did.
Oh, that's too bad.
Yeah, that's good. See, on those first couple, I think you went too far from, you know, just stay in that real area
Okay.
and make sure you get the pigment. That's like almost like a half moon. So now you're doing
Yeah.
the top of that. Great. Good. Give her a break. Good. That's perfect. All you have to do is just pull off enough to give her a little respite. Excellent. Okay, break. Good. One. Yeah, good. Okay. This one's easy because the pigment just dissipates and then you know where to tap.
And just hold
Yeah,
it,
it's a little bit-
hold
it's
it
a
a
little
little
bit-
bit longer till you
There you
really
go,
see
good.
the change.
Static tap. Perfect.
There you go.
Good job. That one will be easy to figure out where you've treated. Good. Now, the reason that might not, now it's changing color.
Yep.
Okay. And perfect. Like 3 taps, give her a little break and good traction. Well, that's changing color, isn't it?
Mm-hmm.
Great. Pam, you're almost done on this.
Mm-hmm.
All right.
Good. Just a couple more.
A little dab right there on that way.
Good job. Look at that.
Wow.
Excellent. Well, I'm going to call this, I'm going to call it a little keratosis or fibroma.
Okay.
It's not a flat brown spot, obviously.
Okay, give me,
Okay.
that's, I guess I've always been a little confused between fibroma and keratosis. How do
Okay.
you know truly the difference?
Fibromas are typically pigmented,
Okay,
but they're really not that much different.
all
They're-
right.
I'm looking for a color change. Now, just to clarify, this also says tap while moving, but the difference is, I think I hold a little bit, just a tad longer on these because they're fibrous. And I'm still above the skin. You feel that? Good. Okay, I got that one pretty much. Dab that other one more time. That's a little too much. Stretch, tap, tap, tap. Good. Couple more, tap, tap, tap. Okay,
a
now
little cupcake.
let's show you in the mirror.
Cool.
Okay? Now, if I wanted to, I could roll that off there, but we don't want to do it because it's on your face. That
Right.
will slough.
Okay.
Just take a mild astringent and clean the arms and hair.
Okay.
I don't get
So-
into a big drawn
So
out
I
thing
could
'cause
just use some witch hazel?
Yeah, you could
or-
use witch
okay,
hazel.
Alrighty. Except I need a pedal.
oh yeah.
Okay.
Oh yeah, I just want to watch.
Alrighty, cool.
We should be, Brooke, are we between 20 and 30 on our power?
You're right at 30, a little over 30.
Okay.
There we go. That seems a little
Yeah,
juicy.
Yeah, that's a little good though. Good use of your good stretch too. Oh, now I hear it.
Yeah. And you don't always hear it. It's the witch hazel that makes the little sizzle.
Sandy
Just
number
depends.
one's the bomb. She's like, this is nothing.
Hey, I knew she could handle
Good.
this.
It's quite interesting.
Mm-hmm.
What it does is that pigment has kind of percolated up into the epidermis, that very top layer of skin. And what this does is it thermally vaporizes that little pigment, that melanin. It's really neat. With very minimal damage to the underlying tissue, hence no scarring. And see, she's a very pretty gal, and she's got a few dramatic, more no, but I mean, you've got diffuse, but we don't have to take off every single little one.
Yeah.
It's just the ones that are, that stand out.
And you can see where I've had things taken off of me and they've left scars on me, so.
I wonder if it's the same guy that treated our last client.
I don't know.
Yeah.
I've seen some really wild things here.
I mean, both of that spot on both arms. I've
Did
had
they freeze
really
that
bad-
for
Her
you?
tendency is to
Yes,
stay on
that's
her
why.
for a while, because
Yeah.
she's been pretty good.
Again,
Yeah.
the cryo can tend to really be dramatic on the skin and spreads out too, so it even gets the bad tissue, but the good tissue.
Remember,
What-
you're looking for that color change.
What scared me with the cryo here in this, because I'd worked on so much light skin up where we are. There's so much more Hispanic,
Yes.
more melanin here. Was like I was afraid I was going to add more melanin to it. I was like,
Well, with the cryo, yeah, you possibly could if you snowball that up 2 or 3 times
Yeah.
that you used with that cryo probe, sure.
doing okay, Sandy?
Trauma will typically cause increased melanin. I have
Yeah.
a lot of Hispanic women that wax their upper lip and their chin, and you know what? It looks like they have, what's the mask of pregnancy?
Melasma.
Melasma on their lip.
They got a little
But it's
mustache.
from that traction. Good. A little bit slower. Good. Yeah, tap, tap, good. Good. Yep. You can see those things are kind of contracting.
Yeah, hers are pulling right
Yeah.
up.
And see, I would schedule Sandy on an hour, because it would take me about an hour all the way through. For an extra treatment, you could actually microderm the areas that you're going to do, because it'll slough away that. That's really good, Sandy. I can leave you alone probably now.
I know it. She's awesome.
Let's go for it.
Yeah, look, she's really got the chutzpah. Great technique. You're perpendicular, you're tapping really nice, great traction.
This one while we're at it.
Good, so in this case you're kind of working wrist to the elbow, and that's your methodology there. Good.
Doing okay, Sandy?
Sandy's
Yeah,
not
I'm
making-
fine.
There you go, babe. Woohoo! There'll be a little pink because we've, irritated the skin a little bit. But I'll put a little calming skin gel on there, and I'll take the sting away.
When I've had them did the freezing, that hurt worse than what
Yeah.
this does.
Going to treat that with a moisturizer sunscreen, and try not to, during this time of the year, keep your arms covered if you can, because we don't want to expose them to more sun.
All right.
And you're always going to wear sunscreen from now on, or if you probably do now.
Forever.
You're-
I
yeah.
didn't.
No, none
I
of us
know,
did.
we laid out in the sun and that was the only thing I had to do where I grew up was lay in the water and bake
Of
in
course,
the
it turns
sun.
brown.
So-
like what
Where's
we-
home for you?
Truth or Consequences, New
Oh,
Mexico.
nice, okay.
Yes.
Some
Elephant
local
Butte.
New Mexico folks today. That's cool.
Now, Yvette has some very.
Oh.
Sorry.
Yeah. Well, good. See that color change? Perfect. You got that down. Okay, that's good. Now
Okay.
watch. If you know how to do this, but if we were going to, there we go.
See?
There's our pigment.
It's right on.
See? But see how I like gouged her a little bit? But if you want it, that's okay for that one. It's like, I always say we're taking the manhole. Number one, you'll probably be able to see where you've treated. But a lot of times it kind of all melts together and you don't want to treat a second time.
Do you want my makeup off so they could see it?
Only if you don't mind.
No, like how long is this going to take?
Not very long.
Oh, she's going to take about 5 minutes here.
Okay, that's
What do you
okay.
got, Yvette?
Oh no, I'm just going to go tell my husband that he has to do my chores.
No, but what do you?
Oh, what do I got?
Telling the story.
You're a young, attractive lady. What are you talking about?
Oh, the makeup is a wonderful thing. Trust me. After I had my kids, I got this brown spot, and it looks like a black eye. Well, I've had dermatologists looked after it. I've had my liver tested because they said it looks like a liver spot, so I've had that test. Well, the only thing it's been getting lighter is because Sandy has been working on it.
She's
over
been
a
peeling
year.
it and stuff,
we've
right?
been doing a
Creams.
chemical peel,
Okay. Peels.
and it has gotten lighter, but
It's,
I was
didn't
doing-
anybody tell you it was melanin from pregnancy hormones? It's called the mask of pregnancy, typically.
yeah, I know it's that.
Yeah.
Now that one's got a hair, so I can't do that one. It's a mole.
See, traditionally, anything that's produced by hormones like that is deposited deeper in the dermis or epidermis, but it's going to be in the dermis too. So we don't treat the mask of pregnancy.
Cannot treat that with
And
this
it's
machine.
a huge, broad base, you know, typically. Yours might not be that big, but
Oh, it's big.
yeah. We would probably say treat something that's smaller than a dime, an age spot or brown spot smaller
So
than a
I'm
dime.
thinking I can treat some of the things on your face around the two big areas, but we'll just keep doing what we're doing on those. Because she does. She looks like somebody went
Yeah,
right under her eyes.
absolutely. And the peeling is the only thing that we have in our bag
Mm-hmm.
of tricks that can really
Yeah.
work. The Skin Classic doesn't do that, only because that pigment, like you said, is in the dermis. It hasn't broken off and come up, percolated up through the skin.
Mm-hmm.
It's staying in the dermis area, so this machine isn't for that.
Oh,
But
I
like when
understand
you
that now.
when you have those cystic lesions
Mm-hmm.
through your, we can treat those now, so they don't have
Oh.
to be big owies.
Yes. This is great.
They'll be gone so much quicker, a couple of
Well,
a day
and
or
see,
so.
hers will get so inflamed they'll
Oh,
leave
it's painful,
hyperpigmentation
yeah.
from her for her. So
They'll
yeah.
blame-
Okay, off her eyelid.
Yeah, you can just keep your eyes closed, Sally. She does have real nice skin. Scandinavian gal, I would say.
What's she doing in Carlsbad?
I don't know, but we're
Getting away from the snow and the
Yeah.
cold, you kidding?
we're keeping her.
Okay, so, yeah, I mean, like,
And she does have a little hyperpigmentation or keratosis or something going on right here. I had to
Is
look
that-
at a little closer.
By the lash?
Yeah, this one over here, babe, right
Oh.
here. Okay.
we actually see cholesterol deposits in the lash line. I haven't treated one of those in ages, but, you know, that's a little scary. A little cherry angioma,
Yeah,
or
she's got a little
glabella.
one there.
Okay. Look at that little blood vessel below her nose. And in this case, Sally, we could have you hold the mirror or just look. And we're looking at identifying a couple things. Just look at that little cherry. See that little red spot there? And then we're looking at that little hyperpigmentation
Right.
there.
And below my nose.
And that
We get rid of that.
hyperpigmentation is typical of sunglass wearers at times. You know.
Because you get framed.
And
You know,
she
how
might
old of a
have
gal are
little-
you, Sally?
64.
All right. Look great. God, she doesn't have many lines in her face.
I know,
does she?
she's a good girl.
Yeah. Boy, oh boy. Okay. And see now her cheekbones. We want to go to that. We'd want to switch to that F6 for her because they're fairly diffuse. Now you can decide maybe today. We could do them if you want, but we could get
What do
these
you
other
have
little
going on
things.
in the next few days?
That's the big thing.
Nothing really.
Okay. Because
Will I be
I
a little
would
beat
I
up?
would like to do that, but you are going to have a little downtime with it.
Okay.
Okay, you will be a little flaky, or you know, it's almost like a little crusty, and it just has to have some time to come
Okay.
off. Okay.
And the cheeks get pretty blotchy looking.
Yeah, you will look kind of
But
blotchy.
you can put some
Yeah, I would love to
foundation
have
on.
that taken off.
I think.
Well,
I think
let's
it's a
look at that
mole.
one.
I need to
Where's
get
her
a.
skin light? What did I do with? Oh, here it is. Let's take a look. How long's that been there, Sally?
You know, it hasn't been there real
See,
long.
it gets on that.
But it's
all the
my,
time.
you know, my
What?
chain.
Okay, so look at that one.
That one's been there forever.
Yeah, okay, that's a
Yeah.
mole. So
Yeah.
they're close together. So we're thinking, why don't you take a look at it and tell me what you see? You see a vascular bed. What exactly do you see under there?
Yeah, it does.
Yeah.
I
Let's take a
think
look.
it's
Dermatologist
yeah,
time.
dermatology time.
Okay. The other ones I was worried about were.
Stretch, and I'm gonna touch Sally.
Until you see something happen.
See it disappear. Good job. That's excellent.
And that's it.
All right.
Can you deal with it?
I can handle that.
Okay.
That was very small, Sally, but still, you know, do you, when you look in the mirror, do you see that little blood? Okay.
Well, let's go ahead and get this guy and get him out of the way.
All right, before we go.
Oh, we have
yeah.
to have some moisture.
There you go. You hear that snap?
Little
Yeah,
snap.
little snap. Okay, here's one more.
Okay. A little ouchie.
Okay, here we go, Sally.
Tap 1, 2. Tap 1, 2. Very good, because most people tend to go a little too fast on this.
Even though you may see it
You okay?
blanch,
Yeah, you want to see that.
even if you do see it blanch, like you said, you have to have enough time of high frequency on the skin to pull that fluid.
Okay, good. Yeah, good. So it really doesn't matter what end of the vessel you start out, Sandy, except where the tissue is a little less sensitive, that's where I'd start.
Mm-hmm.
So on the nose, I almost always start at the cheek and work in. And with this one, you want to start out and work
Bottom,
in, because
work in.
it's really going to be a little...
Okay. You ready,
So
girl?
Are you sure about that?
Yeah, sure.
Okay, here we go.
You're an awesome model. You're good.
You're my friend.
All right, wait. Before you do it, Sally, look at that blood vessel one more time on your... No, under your nose. Okay, now, she's going to go ahead and treat that.
Right.
Okay.
Okay.
Okay, we'll be gentle.
It's a little ouchy. Great stretch. See? You're only going to be able to do 1 or 2. Yeah, and maybe go traction that way, down a little, yeah.
Yeah, pull down.
Just to try to get that.
That is one of the most sensitive
Yeah,
areas.
she might
isn't
tear
it?
up from that.
And we can just do a little bit at a time,
Could do
too.
half one.
Absolutely.
Okay. We're about halfway there.
Now, when we do that on your cheeks, it won't hurt. It won't be as tender. I don't-
Okay.
I wouldn't think.
And this is a pretty good sized one, too.
Yeah.
See, and we got the fine filament too.
One, two.
Okay.
There we go.
Good.
You're good.
Yeah, poor Sally. I always get her to
you're
do
good.
this special thing.